people? It's your nurse Gladys at the Nurse to Follow. And yes, I'm back, guys, and I'm back for good. I'm sorry I've been away for such a long time. My schedule got too tight, and one thing led to another. But the most important thing is I'm back now, and I'm back with so much more to serve, I promise. So, our topic for today will be centered around certain mistakes that nursing students do in preparation for the NCLEX exam, whether PN or RN. These are mistakes that I've observed so far most nursing students do in preparation for the NCLEX exam. So, stay tuned, guys. Welcome back, guys. If you're new to this channel, you're so welcome to a Nurse to Follow. Please do not forget to hit on that subscribe button and on the notification bell so you can get notified each time I upload a new video. And if you're a returning subscriber, thank you so much for returning. Do not forget to leave your comments down below at the end of this video. Without further ado, let's get started. Mistake number 1: uncontrolled anxiety. Okay, I must say this. It is very normal to feel anxious prior to any exam or when taking any exam. There is that normal level of anxiety. It's a normal physiological response, okay? It only becomes a problem when it gets to that uncontrolled level or state whereby it starts to hinder your critical thinking abilities. Once you get to that level, of course, it can affect your overall performance. There are many factors that can lead to this. For instance, when preparing for your NCLEX, there are so many prep materials for students to utilize. You have HESI, you have Kaplan, you have ATI, you have UWorld, you have Saunders. There's so many of them, and many students are tempted to use as many as they can with the belief that the more study prep materials you have, the better prepared you will be. No, I disagree with that. I totally disagree with that. Limiting the number of prep materials to a fair number should be the goal, okay? For instance, 2 is a fair number. You could have UWorld, you could have Saunders. You could choose to use just these 2 prep materials. You could choose ATI, you could choose HESI, you could choose Kaplan. 2 is just a fair number for me. If you want to overdo it, 3 at most, but I think 2 is enough to prepare you for your NCLEX exam, whether PN or RN. And guys, I'm not just talking from a layman's point of view. I've taken the NCLEX PN exam before. I've taken the RN. I'm into full-time teaching in a nursing school, and I'm currently doing my PhD in nursing, specialty nursing education. So I'm talking out of experience, okay? So I disagree that having more prep materials actually prepare you better. No, you just need to have a fair number of them, because once you get this many prep materials or tools and you're unable to cover them all, you start feeling like you're not well prepared. You start feeling like you still have a lot more to do, and that starts building so much pressure within you. You start putting so much pressure on yourself, and that overwhelms you, and you start having this anxiety, and before you know it, it gets to that level where you can no longer control it. So please just avoid this from happening. During my time, I only used UWorld and Saunders, and if you choose 2, I would recommend that you have UWorld as one of them. This is not sponsored. It's just from my own from my personal experience. I think UWorld prepares you so well. I love UWorld. Their questions are wonderful, and yep, I always recommend UWorld all the time, always. So that is that with that mistake. And mistake number 2: Mistake number 2. This is very common mistake. Very, very common. Very common. Procrastination of your exam date or prolonging your exam date. There is no need for that, guys. Trust me when I say so. There is no need for that. Some people go as far as even canceling their exam dates and rescheduling. See, if you've studied well, you should trust your guts and go take your exam as soon as possible. Please. There is no need for the delay. If I were to advise, I would say at most 3 to 4 weeks. That's a perfect time for any kind of revision that you need to do to utilize your prep materials. 3 to 4 weeks is enough. But on the other hand, if you've not been studying as much as you were supposed to, if you've been piling a lot of stuff to do at the end of your program, of course you need more time. You need more time to revise. But please, I would advise, do not go past 3 months. 3 months, if you go past 3 months, that's a lot. 3 months is enough time to catch up, okay? There's a reason why I'm saying this, because once you complete your nursing program, you still have materials in here very fresh, and you've been exposed to so many questions during the course of your program that your critical thinking ability has improved so much. You easily understand, you easily interpret questions, you understand them better. But once you start leaving that gap from when you finish your program, like going past 3 months, you start forgetting a lot of stuff. It takes you more struggle to understand something you could easily understand in the past. You struggle a lot. So I advise, do not go past 3 months. That's the highest you can go. If you go past 3 months, my dear, I'm telling you, you're putting your exam at jeopardy. Trust me when I say so. You don't want to go past 3 months. If you've been studying well, trust your guts, go take your exam as soon as possible. On the other hand, if you've not been studying well as you should, you can, 3 months is enough time to catch up. That is even too much. I would recommend 8 weeks. It's enough time to catch up. That's enough time to catch up, guys. You don't want to go past 3 months. And believe me, you will hardly feel 100% prepared to go take the NCLEX. You always have that doubt in mind, like you're scared. Is it time? Have I covered enough materials? You ask yourself those questions. Trust me, you just have to trust your guts and make that decision. I'm going for my exam in 2 weeks' time. You have to make that decision and go. You will never feel like you're 100% prepared. So that is that with mistake number 2. Mistake number 3. Failure to identify your learning style or learning strategies. Now, this is something that you're supposed to have done from the very beginning of the nursing program, like from when you were taking the A&P, okay, or in the course of your program. You're supposed to have identified what way you learn best, what kind of learner you are. There are different kind of learning styles and strategies. If you're a visual learner, you should know. If you're an auditory learner, you should know. If you're someone who learns more by, doing some hands-on practice, there are people who learn by writing or by reading and writing. So you should know what way you learn best to be able to know what works best for you, so you can understand materials better and retain better too. So you have to identify the learning styles or strategies that work best for you. That way you know if you should join a group for studying. Myself, I hate group studies. I don't like to study in a group because I'm one person who likes to read and write, do my own summaries. So that's another learning style. I also like to talk. I teach others and I retain materials better. So this worked best for me when I was in nursing school, and it's still helping me even now in my PhD program. So you have to identify what learning strategies work best for you. And if you're a group type, like you study best in a group, like doing group studies, always assess yourself. Okay, ask yourself these questions: am I grabbing enough materials from this platform, from this group? Am I really getting what I need to get from this group? If you evaluate yourself and you see that you're not getting as much as you really need, then you can as well just leave the group and study on your own, and use other strategies and styles of learning. Okay, but if you think the group is really helping you, because sometimes study groups are made so large that it becomes more of a distraction than a studying platform. Okay, so you have to be very careful when joining study groups. You have to define your goals. Okay, be goal specific. Make your goals for each day. For instance, you have, at this point, if you're preparing for the NCLEX, you have to set specific goals for yourself, guys. For instance, if you're using UWorld, you may want to set a goal like, by the end of each day, I should be able to answer at least 100 questions. Okay, let's say in 3 weeks time, you must have answered almost everything, depending on the bundle you bought from UWorld. And I won't advise you to go for the 6 months bundle. The 3 months bundle is enough. That way you're working with time, and you're preparing yourself to go take your exam as soon as possible. Okay guys, so that brings us to the end of this video, and this is part 1. Part 2 is coming up, guys, so you want to stay tuned to this channel. Part 2 will be talking more about the mistakes that nursing students do while taking the NCLEX exam, and of course propose solutions to this problem. So stay tuned to this channel. Again, if you're new here, please do not forget to hit on that subscribe button and on the notification bell, and drop your comments down below, guys, and see you in my next video.